very long-winded on this. But so yeah, I'm discussing inequities in perinatal outcomes experienced by Black communities. And so I read 3 different articles and kind of just summed up their main points, and also just kind of took from the experience of individuals that I know and friends of friends and families that I've heard of and things, and kind of just put it into some bullet points. So the first reading talks about how perinatal health outcomes in the United States are worsening in general, and then Black communities are experiencing, the greatest burden of this, like other countrywide issues. And so it defines structural racism as policies and practices across political sectors that award white people with unearned access to opportunities and resources that are denied to Black communities. And so it talks about overall how structural racism increases the mortality and reduces overall health and well-being of Black women during and after, as well as before birthing. And so the report kind of talked about how novel measures such as neighborhood level segregation and county level disparities in incarceration and elected officials are correlating with poorer prenatal health outcomes for Black birthing people. And so they did an analysis of 4,700 Black women, and it concluded that neighborhood segregation was leading to higher rates of spontaneous preterm birth, which is something that you were discussing, Noreen. And so it kind of just stresses the need for new models of care and interventions that are going to target these structural racisms if we want to eliminate inequities systematically. And so I did include a quote here that I thought was pretty good. It says, "Health systems that ensure patient-centered access prioritize approachability, acceptability, availability, accommodation, affordability, and appropriateness." And so they kind of go into the fact that current models right now that we're seeing in healthcare institutions are worsening inequities by perpetuating those barriers that I just mentioned to the following aspects: insurance limitations, racial, cultural, and language barriers between patients and providers. And then a statistic in this article was also the fact that, and it's interesting because we were talking about CPS earlier today, that Black infants are referred to CPS at delivery 4 times more likely compared to white infants, despite similar rate of using alcohol and illicit drugs. And this was a study of 8,500 women. Another thing that they discussed, which I thought was really interesting, is that coercive practices of family planning or birth control are being experienced by birthing people. And so they're seeing a discrepancy in the rate at which Black women are pressured basically to undergo procedures such as sterilization, and as well as legislation that's being enforced in particular areas that are have high concentrations of Black women. And so basically they have legislation that's saying basically you have to be using contraception in order to have access to certain social services. And that's, again, a discrepancy in certain areas where there are greater concentrations of Black people. And so it concludes by kind of talking about how, this is why a lot of the Black community has a strong distrust of the healthcare institution because of these inequities and injustices, and a multitude of others that exist in healthcare, so not just like perinatally. And I'll add the other inequities that exist in most of the systems in this country, which I'm gonna talk about at the end. And so the second article that I read was about how Black women across the spectrum in various socioeconomic statuses, various education levels, living in various parts of this country, rural and urban areas, are dying from preventable pregnancy-related complications at 3 to 4 times the rate of non-Hispanic white women. On the same note, the death rate for Black infants is twice that of infants born to non-Hispanic white mothers. And so again, it's just talking about how structural racism in healthcare and social service delivery is basically resulting in the fact that African American women are receiving poorer quality healthcare than white women. And so what that looks like in a clinical setting is that Black women's needs, their requests, our concerns, our pains are not taken as seriously as everyone else's. And so that leads to, increased pain and the perpetuation of illnesses that could have been taken care of earlier on. And so increased morbidity and mortality rates because of that. It talks about the breakdown. I won't go too much into this, but it talks about weathering because we talked about that in the course at the beginning, but it does talk about weathering and how that's making Black women more susceptible to medical conditions such as preeclampsia, eclampsia, embolisms, and mental health illnesses that are threatening Black women's lives as well as their babies' lives. And then it outlines 3 different or policy strategies in 5 different areas to address these issues. I won't go into specifics, but it does specifically offer some policy-based solutions there. And so the last article that I studied was, so it's basically talking about how Black feminist scholars, researchers, and activists are now challenging this historical and social concept that race is a risk factor for birth outcomes, and they're finding with recent studies that racism is actually the race factor as opposed to race. They talk a lot about how obstetrics and gynecology were developed initially using harmful experimentation and exploration of Black women's bodies. Again, you can kind of think about why there is like this distrust of the healthcare institution. They talk about how the use and knowledge of Black grand midwives was obliterated by white male physicians and white female certified midwives. And so this is again during times of enslavement, and this robbed Black women of the support and information that midwives provided their patients at the time, and thus significantly contributed to the horrific statistics that we're seeing today, especially because we know that using midwives and doulas results in better birthing outcomes for everyone, but specifically for Black women. And so this is kind of like my own conclusion, a little bit more than just the topic, but this research is basically exemplifying how historically Black people have been robbed of methods, systems, assets, and cultures that put us at a significant disadvantage in various aspects of life. And so we see the issues with healthcare. We also see this issue in education. Of course, during the enslavement era, we were not allowed to read or write, and now there's a lack of funding and resources for schools in areas that are more highly concentrated with Black people. Our culture has been essentially robbed, of course, when we were brought over here, so a lot of Black people don't know our history, don't know, where we come from, and that kind of perpetuates the issue of union and community amongst Blacks because, and then the more recent attempts to develop culture often leads in appropriation and gain for other groups. And so that's kind of an issue there with culture. And then unequal housing opportunities. We know that, of course, back in enslavement times, we're unable to obtain property and expand upon our assets. And now we still see higher interest rates for people of color. And so that obviously hinders on developing assets and increasing wealth. And last system, of course, there are many more that I could talk about, but the last system is that we see disproportionate incarceration rates for crimes that are done at similar rates compared to other groups. And so, of course, if you're locked up at higher rates, it's more difficult to get jobs, it's more difficult to obtain housing, etc. And so I just want to make the conclusion that when we see inequities in the majority of systems in the country, I just want to stress the fact that this is what we mean when we're talking about systemic racism. That sometimes we think we know what it means, like, oh, there's some laws and policies that are like inhibiting certain groups, but when it exists in so many different aspects of life, that's why we see the big picture of, Black people remaining subordinated essentially and having more of a disadvantaged time of getting ahead. And that's it. Woo!